Is Dr. Vince Gutierrez. I'm a physical therapist. I'm an orthopedic certified specialist through the American Physical Therapy Association. There was a question asked recently on one of the forums, how to get the best results for knee flexion and extension after your surgery. And the research is pretty clear on this one. Having better knee range of motion going into the surgery gives you better knee range of motion coming out of the surgery. So the question was asked, well then what exercises are recommended for improving knee range of motion, improving knee bending and straightening. This is one that I like to use in the clinic. It's laying down on a table. You'll put your foot up on the wall. If I were to have patients do this at home, I'm always asking, do you have a big headboard? Do you have a bed next to the wall? Any way that you can lay down on your back and get your foot elevated on the wall. So when you do this, you'd have to get your butt pretty close to the wall, so you've got to be kind of mobile, and your foot has to go up on the wall. You're going to use the unaffected leg to help with bending and straightening, and I'll show you that in a second. Some of the patients that I won't do this with are patients that have trouble maneuvering on a bed. They just don't have the mobility to get around, and I'll show why that's important in a second once I get some of this stuff out of my way. I'll show why that's important in a second. Patients who have trouble breathing if they're on their back, it's going to be an automatic no-go for me. If you're doing this in your own home, you can choose to scuff up your walls or not. I use this wall a lot for doing this exercise because it's the only table that I have that's kind of near a wall with some space for me to move around in the room. So what I'll do is I'll have the patient put a pillowcase on their shoe or over their shoe, or I'll have the patient take their shoes off so they're in their socks. So here's what the exercise looks like. You'll take the pillowcase, slide it over your foot. You'll get kind of close to the edge to start with, pillow, no pillow, your call. You'll get kind of close to the edge, meaning very close to the wall. And then you're gonna lay back. All right, so patients who have less than 90 degrees of knee flexion, their knee is going to be at best here, okay? One of the reasons why I like this exercise is, one, the pillowcase reduces friction, so it slides up and down the wall easily. Two, you have gravity assisting you. So gravity is actually providing this downward force to begin with. So if I were to just let my leg go, it's going to fall in this direction. It's different than doing it on the table. People talk about heel slides, and I'll show that one in another video. But it's different than heel slides because heel slides, you don't get the assistance from gravity. All right, so gravity is already helping you, and you actually have to fight gravity with this muscle if you were to raise your leg back up. So what I would tell patients to do is allow gravity to pull them down until they can tolerate that bend. Hold for 2 to 3 seconds. They can underhook it if they have trouble raising the leg up, and then they raise it up with their unaffected leg. Anytime that we're looking at stretching activities, it has to be done for a long period of time over the course of time, right? We have 3 concepts, and you're going to understand these concepts in a second here. They're called creep, hysteresis, and set. Okay, so creep is essentially the deformation of tissue. As we bend, we start deforming the tissue into more of a bent position, right? And the longer we hold it, that position stays bent. For instance, if you take a slinky and you change its shape by straightening it out and you let it go, the slinky snaps back to the way that it used to be. All tissues have that creep, deformation of shape, hysteresis, the slow bouncing back, and then, or fast bouncing back in the case of a slinky. And then the last thing is set, meaning the new position. If, some of us who are having knee replacements and having knee surgeries, I've had a couple knee surgeries myself, we're old enough to know slinkies, right? And if you've played with the slinky long enough and, you've stretched it out long enough, it loses its shape, right? And that's kind of the principles that we want to use on the knee. If the knee is having trouble bending, we want to bend it enough over the course of time to make it lose its shape into more of a bent position. So the knee will actually become looser, the structures will become looser over the course of time, and you'll actually be able to bend your knee further and further. So I really like this exercise in particular because gravity helps you. You don't have to do as much work. You can always overpressure it with the other foot. If you can tolerate more bending, you can help it out with the other foot to help raise it back up. So this exercise is my go-to for getting bending back if the patient is able to lay down on their back and maneuver on the table. Now, if the patient has trouble maneuvering on the table, I'll bring them back into the traditional heel slide exercise where they're straightening the leg, bend as far as you can go, overhook and pull. I'm not a huge fan of this one because this one takes a lot more effort to pull the leg back or to bend the knee than the one on the wall. So if I have to do this one with a patient, I will, but this is definitely not the first exercise that I'm going to choose to use with the patient. When you go to get up, you might have a little bit of trouble, so you'll see that I did the log roll positioning there. Some patients who lay down in bed, especially patients if they're stiffer and they have some back issues, they can't just pop and pop. And so what they'll tend to do is they'll lay down, and we'll actually teach them to roll to their side, put their other hand on the table, prop up onto the elbow, and then help to push themselves up. Like I said, this is my favorite exercise for getting more knee bending. The table is my second favorite exercise. I'd rather not use it if I don't have to. And my least favorite exercise is the sitting version of this. I just don't find patients progress as well in the sitting version as they do when they use the wall. Pay attention for more videos on how to regain knee bending and knee straightening over the course of time. Thanks. My name is Vince Gutierrez. You can find me at movementthinker.org.